y'all, Michaela back from Hospice Nurse Basics, and today we're going to talk about other medications that can be given if a patient or family member is uncomfortable with morphine. This is something that comes up often, and we want our patients and families to know that we have other options for them. But before we get started, please subscribe to the Hospice Nurse Basics YouTube channel for more detailed content. Let's get back into it. Now, there are several reasons why individuals may not be comfortable with morphine. One could be that they're allergic to it, or maybe they're afraid of becoming addicted, or maybe even overdosing on morphine. Another very common reason is some people at the end of life feel that medications like morphine could affect their initial experience into the afterlife, and they will decline heavy medications. Or maybe they just don't want morphine. Maybe they've heard stories about morphine, or they've had morphine in the hospital and they didn't have the best experience. Maybe they experienced some side effects. Whichever the reason is perfectly fine. Now, if you do have a patient that is uncomfortable because they received morphine in the hospital, it's always important to educate the differences between having morphine through an IV versus taking it by mouth or sublingually. But without further ado, let's get into the other options. So from my experience, the most commonly used alternative to morphine is hydromorphone, which is also called Dilaudid. Now, this medication has a very rapid onset. It's almost like instant. So it also wears off quickly. So your patient may need to take it often to get symptom and pain relief. So next we have oxycodone, and this medication can be given sublingual with sublingual tablets or liquid. And compared to morphine, oxycodone has a more rapid onset, so it's going to work a little faster and also not last as long. The duration is a lot shorter than morphine. So now we have fentanyl. And y'all, back when I first became a hospice nurse, this was our go-to medication. We use fentanyl often, usually the patches. But over the years, we've heard how potent this medication is and how people are abusing this medication. And mainly because it's 50 to 100 times more potent than morphine. Typically, with these patients who are on fentanyl, it's given in a patch around 12 to 25, 50 to 100 micrograms. But again, it's so potent that we have seen that patients who even use a 12 milligram or 12.5 microgram patch, have died. So you want to be extremely careful with prescribing this medication to your hospice patients. And lastly, we have methadone, which is another very potent pain medication that we can offer our patients, and is best used for patients who have a history of drug abuse. But keep in mind, 5 milligrams of methadone is equivalent to 7.5 milligrams of morphine. So it takes less methadone to reach the effect, meaning it again is more potent and requires less. So be very careful when prescribing this medication to your hospice patient. Now, of course, there's other options out there that you can choose from to get pain relief to your patients. Just check your hospice formulary to see what's covered, and make sure to talk to your hospice medical director and pharmacist about other recommendations. I hope this information was helpful. See you guys in the next video.